What if I told you that there was a completely legal way to get $432 of prescription drugs for just $24.50? Or that buying drugs overseas can actually be cheaper than using Medicare Part D? We all know that prescription drug costs are one of the most expensive healthcare costs, even if you're already enrolled in a prescription drug plan. That's why in this video, I'm going to walk you through 3 completely legal alternatives that could save you hundreds or maybe even thousands of dollars on your medications. But I'm also going to show you the potential dangers and downsides in using these methods so that you can decide for yourself whether or not the savings is worth it. The first way to reduce your drug costs is by using GoodRx instead of your Medicare Part D plan. GoodRx is a website that helps you find lower prices on prescription medications by giving you coupons for local and online pharmacies. There are several other sites that you can look at as well, like costplusdrugs.com, that can help you to save money on your medications, but GoodRx currently is the most popular. So here's how it works. You go to goodrx.com and you put in the medication that you're looking for. And in this case, we're going to use a prescription called atomoxetine. Make sure that your location is set correctly. You'll see a list of prices from different pharmacies nearby. Click on a pharmacy like CVS. Now you'll see that 3 buttons appear. You can either text or email this to yourself, or you can print it. Then take the coupon into your pharmacy, and you'll get the drug for the price that's listed there. Now, here's what that same drug could cost if you're on a Medicare Part D plan. $406.50 at the pharmacy or $298.80 for mail orders. That's 10 to 15 times more than the GoodRx price. First of all, this is not some sort of fluke. This really happens. It really does happen, and we see it frequently, but this is a more extreme example. So we'll call this the best case scenario. Atomoxetine is a generic, and so it's priced really low on GoodRx. We often see that generics work better on GoodRx than brand names. So if you have a brand name drug that you're looking for, your Medicare Part D plan is still probably going to be the better deal. Another strategy that people are using is that they're ordering their prescriptions from Canadian pharmacies online. That's because Canada has strict price controls on prescription drugs, while in the US, pricing is pretty much unregulated. So the exact same drug in the US will be cheaper in Canada with the exact same manufacturer. And then another thing that happens is that in Canada, the generics come faster. So you might have a brand name here that is available as a generic in Canada. That's why some people look into Canadian pharmacies as a workaround for expensive medications, especially if their current plan is not giving them a good price on something that they need. Now that said, this comes with a few wrinkles, mainly around safety and timing. If you go this route, make sure that the pharmacy that you go to is a CIPA certified pharmacy. The CIPA is the Canadian Pharmacy Association. Now, there are only like 49 pharmacies that are certified by the CIPA. So instead of making a mistake, go on the CIPA's website and make sure that you're working with a pharmacy that is certified. Now, I am going to leave a link in the description below, and you can look up the pharmacies that are certified. I'll leave that there, but make sure that you're doing that. If you're going to get your drugs from a Canadian pharmacy, they require all the same things that you need at a US pharmacy. You have to have a prescription, just like you would have to have here, and you have to submit that to them. Now, one more thing is that you're not going to get your medication right away. It has to come to you in the mail. Depending on the Canadian pharmacy that you use, it might be shipped from Canada, but a lot of times it's being shipped from other countries. I used a Canadian pharmacy once, and my medication actually came from India. So you have to consider that. It's going to come from far away. So if you need the prescription right now, then it's not a good idea to go to a Canadian pharmacy. You need to go to the pharmacy down the street. The third strategy is to check whether the manufacturer of your drug has discounts or savings cards. These are usually called manufacturer savings cards or patient assistance programs, and they can bring down the cost of expensive medications, and sometimes that price can be lower than GoodRx. But here is the big frustrating catch. If you're on Medicare, which if you're watching this, you're probably on Medicare, then most manufacturer discounts cannot apply. That's because the government doesn't let drug companies have these kind of discounts for people that are on federal insurance programs. They call this the anti-kickback laws. So if you're on a federal program, they can't give you money towards your medication. And that just can really mess things up, because when you were on your group plan before you retired, you may have had a discount that you had through Eli Lilly or one of those companies, and now it doesn't work anymore. So that said, there are some exceptions. Some people still can, in limited situations, get help from manufacturers. So if your drug plan doesn't cover it at all and you're paying completely out of pocket, then go to the manufacturer's website and look into that. That may be something that can work for you. Look at the section called Patient Assistance or Savings Card and see if you're eligible. Just don't assume that the discount will automatically work, especially if you're on Medicare. Now, this brings up a bigger question. If you get cheaper prescriptions from GoodRx or from Canada or by using manufacturer discounts, why should you enroll in a prescription drug plan at all? Now, there are reasons why you need to always be enrolled in a Medicare Part D plan, even if you're using one of these other methods to get your prescriptions. For example, Part D plans have late enrollment penalties. If you don't enroll when you're supposed to, then you're going to get a penalty. And you have to have other coverage if you don't enroll that's creditable by the government, or else they penalize you. GoodRx, CostPlusDrugs.com, and other discounts, they don't count as creditable coverage. And so you're going to start accruing a penalty, which currently is about $36 per month for every month that you go without coverage and go without having a prescription drug plan. And it begins to add up and add up. And then when you get coverage, that penalty will last a lifetime. And 36 cents a month may not sound like a lot, but it's every month and it grows and grows and grows and becomes a permanent penalty. And if you didn't have coverage for 2 full years, which is 24 months, you're now paying almost $9 a month for the rest of your life. That starts to add up. That's another extra $100, $200 a year. Unnecessary, right? And by the way, that penalty increases almost every year because it's based on the national average drug plan price. And so, yeah, you might have a penalty of $9 a month now, but that could be $18 a month in a few years. So you want to avoid penalties at all cost. Now, another thing to note is that if you're using GoodRx or a Canadian pharmacy or Cost Plus Drugs or one of these other sources for your drugs, then your spend does not count towards your maximum out-of-pocket limit of your prescription drug plan. Medicare Part D has a rule that once you spend $2,000 out of pocket, then you no longer have to pay anything. And that's based on 2025 rules. It's going to change a little bit in 2026, go up a little. It's not bad though. So you need to use your Part D plan to be eligible to hit that maximum out of pocket. So if you buy these medications from some other source, it's not going to count towards your $2,000 limit. Now let me give you an example. Let's say that your drug costs $500 on your Part D plan, but it's only $250 from GoodRx. So you're like, well, I'm filling this once a month. I'm going to use GoodRx because it's saving me a lot of money. Well, you're actually going to lose money in this example. Think about this. Spending $250 on GoodRx for 12 months is more expensive than spending $500 with your Medicare Part D plan for only 4 months. Because with your Medicare Part D plan, you hit the $2,000 maximum out of pocket, and now for the rest of the year, you don't pay anything. So don't be short-sighted. Don't think, oh, I'm going to save $250 a month by using GoodRx. Well, over the long run, you're going to lose money in that scenario. So if you're taking expensive medications, it's critical to calculate that and make sure that you're doing it right. In almost every case, if you're taking expensive medications, they may feel like they cost more now, but it's going to save you money by the end of the year to stay with your prescription drug plan. So these other options like GoodRx, Canadian pharmacies, etc., they may be good options for generics, but for expensive brand names, they almost never work out. So I want to be very clear about that. But the key here is to do the math on your specific situation, look at the total cost for the year, not just the cost per prescription or per month. Now, if you want help to figure out which of these strategies is the best for you, for your specific medications, we offer a free 15-minute Medicare consultation where we can analyze your medications against every available plan in your area and show you exactly what's available for you and how much you would pay for the different options. Now, my team, they don't work on commissions like all of these other insurance agents out there. They give advice purely from the heart. They are paid salaries. And so it doesn't matter to them whether you enroll in something or what you enroll in. They're covered either way. So if you want help to figure out what is the best for your situation, then call my team that I've trained here at PlanFit, and they will help you out. And if you want to learn more ways to reduce your Medicare costs, maybe ways that you haven't heard of before, then check out this video right here.